Carpal tunnel syndrome is the most common condition that affects our hands. This is due to pressure that builds up on the nerve. The nerve is called a median nerve and it supplies feeling to your thumb, index and middle finger, as well as part of your ring finger. We can see in the model here that there is a tunnel that runs from the arm into the hand, and underneath a layer here, the nerve runs through. For the vast majority of patients, carpal tunnel syndrome occurs for no underlying reason, but we know that anything that causes pressure on the nerve can cause these symptoms. They're very common at night because of how we hold the wrist at night when we're sleeping, and that's how night splints are quite effective. But during the day, repeated activities such as using your phone, driving for lengths of time, and repeated movements at work such as painting and decorating, and this can cause carpal tunnel syndrome. But it can be associated with diabetes and fluid changes such as what happens during hypothyroidism, or commonly in pregnancy or during the menopause. The symptoms that patients get from carpal tunnel include pain, typically burning pain, pins and needles or tingling, numbness, and if it goes on for quite some time, you can have weakness and clumsiness of your fingers. If you're having carpal tunnel symptoms, we can investigate to see whether there are any specific causes for your carpal tunnel syndrome, and we can also investigate by using nerve tests to see how bad your nerve is affected. The first-line treatment for carpal tunnel includes splintage at night. If your symptoms are not resolved by using a splint, then sometimes an injection can help. If an injection does not help, then surgery can be indicated, and this is a very short procedure, roughly 10 minutes, where we would freeze an area in the hand, just around about here, and go through and take the pressure off the nerve. Typically this procedure is very successful, and the vast majority of patients have relief of symptoms within a short space of time. For this and other conditions of the hand and wrist, I'm available in my clinics in Lancashire, Greater Manchester and Cheshire.